Drink my tea.
Hey everyone, it is Lana here. Setting up, still not live yet. Are we live?
Yep.
Okay.
I got a notification.
Okay, perfect. Hopefully this is working because I can't see. It says I'm live. Meeting is now streaming live on Facebook. Here we go. Welcome everyone to Wellness Wednesday. It is Lana here and I am live with Brenda Vander Zanden, who we're going to be chatting with tonight about reclaiming your body after baby. If you've never checked in for a Wellness Wednesday before, it's an opportunity to learn a little bit more about common things that hold us back as women from being our most active and awesome selves. And what we're going to learn about tonight and what you're going to walk away with are some tips in overcoming problems that Brenda has experienced quite often with clients she works with. So if you are a mom and you're struggling at restoring your core after your pregnancy, you are in the right spot. I also just wanted to remind everyone I am going live with the day. What are we at? Day 4 of the 5-day reset. So we're doing this after the live. So I'm just going to quickly introduce my guest, Brenda Vander Zanden. We've known each other a really long time, and that is not the last name I know her with. So Brenda is a labor and postpartum doula, a fitness specialist and yoga instructor who helps pre and postpartum women love and appreciate their amazing bodies through exercise and movement. She's also the owner of BVZ Maternal Support and Wellness. So welcome, Brenda.
Thank you. I know it's a mouthful. That business name.
How do you say it? Vander Zanden?
Yes.
Right?
Yeah,
perfect.
You have it right. Yeah.
Okay. So I just wanted to start off by you telling everyone who's watching what led you to being so passionate about helping women through their pregnancies and their recovery. So what brought you to this place?
That's a very good question. I would have to say that the fact that I had an eventful birth myself, I have twins. They're now 3.5 years old, but the process of pregnancy was not what I expected it to be because I was an athlete, I was healthy, and I expected it to be a smooth pregnancy and then resulting delivery, but it wasn't the case in either, I guess, spectrum. In terms of the pregnancy, I had morning sickness, but it was extreme morning sickness to the point where I lost weight, especially a considerable amount in the first trimester. And then the morning sickness continued until I was 3 days away from my delivery, which ended up having to be a C-section because I was in the hospital for 1 month before my kids were born because one of the twins was not thriving in my body, which was, again, basically when the expectation doesn't meet reality, that's exactly what it was. So there was a lot of room for confusion and disappointment and just I couldn't understand what was going on with my body. So long story short, finally when I brought them home, I thought that my body would bounce back, you know, the term that we often hear. And I fell prey to that. So I started running 3 months after having twins, which was not a good idea. And I felt a lot of pressure in my pelvis and my hips, and I couldn't understand why. So I stopped immediately because my body was really speaking to me. So I had to stop. And I started doing research, and I found out that there's a lot more about the recovery process that a lot of women don't know about. And that involves the pelvic floor, the diaphragm, and all of that. So that's kind of where it all started. And I was like, I'm hooked. And I went down the rabbit hole and I got certified, and now I want to help other people. So.
That's awesome. What is your certification? Where did you study, and how did you become I guess you're a doula?
Yes.
Yeah.
Yes. I'm a doula, and then I'm also a core exercise specialist, which I found that certification online. It's actually pregnancy and postpartum core exercise specialist. But yes, I became a doula because I really wanted to support other women, not just who had also high-risk pregnancy, because I mean that could happen to anybody, but whether you have a high-risk pregnancy or not, I think that support is crucial. And a lot of times when the babies are born, we focus on the babies because they're so cute, and they really are. But the mothers also need that support. And I realized that when I had my kids, like how much more support I needed. Thankfully, my mom was around, my family helped, but we need to focus on the mothers too and not forget them just because they have a baby and that they're okay with all that responsibility. No, they need to be taken care of as well. So
totally, we got to take care of the mamas. I am not a mom, so I appreciate all the work that moms go through and do, but we need to take care of them.
Yeah.
So
true.
yeah, I was curious to know what you find the biggest problems with postpartum bodies. Like, so what do a lot of women experience after giving birth, and what does recovery look like?
Recovery looks different for everybody, especially depending on the type of birth that they had. So whether vaginal or C-section birth. If it's typically for a vaginal birth, it'll take about 6 weeks for recovery. And then C-section, because you're going through so many layers, it can take 6 weeks to 8 weeks for full recovery. Again, it depends on the person. But one thing I noticed, regardless of the type of birth that a lot of mothers have, is that the leaking that happens after birth, a lot of people tend to think that it's normal and that eventually it'll go away, or the doctors just kind of say like, oh, poo-poo on that. Just buy some Depends, you'll be fine, wear it for 2 months, and then it ends up being 6 months, 3 months later, or whatever. And I just feel like sneezing, coughing, and having any of those normal activities that you do, and like it's a bodily function. But for leaking to happen, whether it's urinary or fecal, is not normal. And that's something that I feel like people need to know. It's not normal, that there are things that can be done to address that problem from the outset. So
I think it's also not to downplay the importance of physicians and doctors, but I think a lot of folks who go to them, and this is an experience I have with dealing with people who are recovering from injuries, doctors deal with you and they get the thing done. You're either healed, tissues are healed, or baby is born, and that's their job, right? And so I think it's important for people to understand that your physician isn't going to have all the answers, because that's not their job. And a lot of them won't tell you that they don't have the answers. They just are like, you're good. You're healed. Move on with your life. So I think it's really important, especially with labor and delivery. The doctors that are delivering the babies aren't necessarily knowledgeable, or really they don't have the expertise in what is going to happen to the body after the delivery.
Right.
Yeah.
So true. Yeah.
And that's where someone like you comes in. There's also people who specialize in pelvic floor rehab and postnatal physio and stuff like that. So I think it's important to identify that there are resources out there.
Absolutely.
You just got to know to look for them.
Exactly.
Right. Yeah. Okay. So talk a little bit about the leakage. What are some common causes for weakness in the pelvic floor, or even tightness in the pelvic floor?
Well, it could be genetics in some cases, and then it can also just be the weight of the baby. So if there's not a lot of toning and understanding of how important it is to relax the pelvic floor as well through pregnancy and post, then that can cause a lot of problems afterwards. Sometimes, and I often read when I was pregnant, that Kegels were so important to start practicing and doing them before you actually had your baby, so that you could make sure that your vaginal canal is tight, and so that's what I was focused on too. But only after studying did I realize that if you do a lot of Kegels, your pelvic floor imitates what happens in your jaw. So if you're clenching all the time and you're really stressed out, that's exactly what happens in the pelvic floor. So when I was doing Kegels or whatever, I was always focused on tightening, and not so much on the relaxation part, which is equally important. So if we were imagine that we're holding a dumbbell and we're doing bicep curls, But if we're holding on to that dumbbell in a contracted, I guess, pose or position for too long, eventually your muscles fatigue, and then it can't actually hold weight the way that it's supposed to or it's designed to. And it's the same way that with the pelvic floor. Like if it's always tight, you're not going to be able to stop the urine, or you're not going to be able to stop the gas or the flow of gas or fecal matter, because it's so used to being tight that you haven't learned to relax and to clench it when you need to, or to tighten it. Yeah. So that's really, really, really important. Yeah.
This stuff is so fascinating. I've been studying something called neurokinetic therapy for the past couple of years. And one thing that I have noticed, so with neurokinetic therapy, it is looking at how your brain's motor control system organizes and interprets movement.
Yeah.
And so trauma affects how your body interprets movement, and so both understands movement and initiates movement. So one thing I've found very often, C-section scars.
Yeah.
Doesn't matter how old they are. I've found people with like 40-year-old C-section scars, and they're like, oh, that was like from 1982, you know? So my clients will think that it has nothing to do with why their back is hurting, but in actuality, that scar is shutting off their abdominal muscles.
Yeah.
And then their back muscles, for example, have to take over. Your abdominal scar can also shut down your pelvic floor. It can shut down a whole bunch of stuff. And also, other thing I learned is your diaphragm and your pelvic floor are the two most common compensators for weakness in through your core. So these are very much related to women who are dealing with postpartum recovery. Is that, you know, we'll get into this in a second, but just how your abdominal muscles, your low back muscles, your pelvic floor, and your diaphragm work together to stabilize you. And when one of those things kind of gets off kilter, which happens very frequently with pregnancy, the effects of that. So this is all so fascinating to me. Did I ask you what, so we talked a little bit about this. So what are some other problems that you find that postpartum women are dealing with frequently? So you talked a little bit about like leakage, pelvic floor issues. What other common concerns or common issues do you see with postpartum women?
Posture and alignment, I think, are big issues as well. But what I often find is that a lot of my clients don't understand the importance of knowing how to breathe properly. So let's say for the inhale, allowing the diaphragm to actually expand, elongate, and then with the exhale, it's contracting. And then at that point is where I try to engage the pelvic floor. So understanding the importance of breathing so that the container, as you kind of referred to, moves and shifts as it's supposed to, and that it's fully functioning. So it's not just about the core, which I think a lot of times my clients come to me thinking like, I just want my abs back. But understanding that the breathing is the first part of it, like that's the foundation, and then everything else comes after that.
Yeah. Well, your core is comprised of your diaphragm, your pelvic floor, your abdominal muscles, and your back muscles. So I think it's part of it is that people don't understand what their core is. They just assume core is your six pack. When in actuality, your six pack has very little to do with your actual stability of your body. So very interesting. I know we had a little chat about we were like messaging back and forth, talking a little bit about rectus diastases. Were we talking about that one day?
Yeah, we did. Yes.
Could you explain a little bit about what that is? Because I'm sure there's some women who are watching who have been told they have this, or maybe noticed that they have it, but didn't realize it was a thing. So do you want to maybe explain that, what it is?
Yeah, sure. So basically, it's when there's a lot of pressure placed on the abdominal wall, which causes separation of the rectus abdominis, so the left and right abdominal belly, if you will. And there's a lot of that pressure from the growing baby pushes on the linea alba, which is the connective tissue that is over top of the, sorry, I'm like using my hands,
Yeah.
but which is over the abdominal wall. So that is what we need to work on, is not so much just bringing back the abdominal wall, but working on the transverse abdominis, which is the corset muscles, the deep inner core muscles, and causing enough internal pressure or intra-abdominal pressure on the core. Oh, the TBAs, sorry, I got distracted here. My light turned off. The lighting has changed. Yeah, so putting enough pressure on the TBAs, the deep core muscles, in order to learn to contract and then to also bring the abdominal wall together. Because the more you do that with proper breathing, it eventually will bring that separation together. But it doesn't always happen for everybody. And I think that's something that needs to be understood, that it's not always going to come back exactly as it was before you had a baby. It depends on the person. It depends on your DNA, your genetic structure. There are a lot of factors that, you know, go into that, but it's every situation is different. But we try to do what we can with all the exercises, proper breathing, alignment, and all the steps. We make sure to follow them. And if you keep up with them, there will be some change, some improvement for sure, but it's not to guarantee that it's going to be what it was before. And that's, I think, something that's really important to mention.
What would, if somebody wasn't sure if they had RD, so rectus diastases, how would they know? What would they see?
They would see either sinking. So if you look in the middle where the abdominal walls are supposed to meet, there might be sinking in that little area, but also there could be tenting or doming, which means that when you sit up or you do a little bit of a crunch, you'll see that you've got like a little bit of a cone shape in the middle, which could also mean that because of that separation, that the whatever's inside the abdominal cavity is coming out or protruding a little bit there.
And for anyone watching, your linea alba is basically like a line that runs from like your pubic bone all the way up through your belly button to like your the middle of your rib cage, so your xiphoid process. So if anybody is wondering where that line is, that is where it is. I see it's with the work I do with neurokinetic therapy. I see doming and I see rectus diastases actually quite often. And it is usually from weak transverse abdominis muscles. And it's very often related to like diaphragm and pelvic floor. So you can reprogram how your brain recruits all those muscles and help with that separation. So it is a thing, and it also doesn't only affect women. I've seen a lot of men with RD as well. So that's really I want you to, so we are, how long are we into this? We've got to be, I don't know what time it is because I can't, we're on Zoom now. So okay, perfect. Maybe before we wrap up, what are 3 things or 3 tips that you wish all postpartum moms knew, or all moms? I guess if you are a mom, you are postpartum. What do you wish all moms knew about their bodies?
Well, what they knew about it. Just to be patient with it, for one. Just to be kind to your body, because the change will happen, but just be kind to it. And I know it's easier said than done, but we are often kind to our friends. If they put on weight or they don't like what they're wearing, we'll use the kindest words for them, but we have to show the same generosity and kindness to ourselves. It's hard to do, but it can go a long way. So that's one thing. But also just to take as we talked about before, about the breathing and the importance of breathing, to take that seriously, because it sounds so elementary, but it can make a huge difference. So the breathing component is really important. I wish I knew that, but eventually I learned. And then also not to suck in the belly, because it interrupts that process and the flow of the diaphragm moving as it's supposed to and connecting with the pelvic floor. So if you're always drawing in, which we often learn about, I mean, women, that's kind of what we've been trained to do. Society teaches us to do that, to suck in, but it doesn't necessarily help with the healing process. So just let things hang out, let it hang out. That's what I would say to that.
I had a vocal instructor tell me once, because I do a lot of singing. And so you have to do, so you actually like, in order to sing and project, you've got to do the belly breathing and contract. And that was her biggest tip. She's like, screw what the magazines tell you. Just let it all hang out. So I'm like, just tell everyone to screw what the magazines tell you and let it hang out. It's totally fine. Any tips, any last minute tips before we wrap up?
I would say that, sorry, I've got my munchkins coming down. I would say, oh, I'm very distracted right now.
Oh,
sorry.
Maybe you could just show us, yeah.
Mommy.
There's one.
Mommy.
And there's two.
Mommy.
Well, I think I think that all the moms watching right now are probably relating really hard.
Yeah.
Your kids just came home.
Mommy.
Good night. I had to say good night.
Mommy.
Yes, honey. Okay, bye-bye.
Oh my God. Mommy.
Well, maybe on that note, we'll just wrap it up, Brenda.
Yeah, I think so. Sorry.
So, have a good night.
Thank you.
Enjoy your boys.
Oh my God.
Thank you.
Bye.
Bye.